Good morning, everyone. Thank you, everyone, for joining. So, before we jump into the agenda, thank you, everyone, for being the leaders of this organization and driving the growth. Thank you. And as you know, the Springfield General Hospital has been the leader in servicing people. And lately, but we are receiving a lot of complaints. So, the purpose of this meeting is to bring awareness about why we are receiving a lot of complaints. Are there any issues? Understand the issues, and then devise some course correct mechanisms. So, in the next sections, we will see generally just a reminder of what is our mission and what is our goal, and where are we now, and what is the current process we want to follow, and what's the next action item, and finally Q&A. Okay, so if you have any questions, please you can ask at the end of this presentation during the Q&A session. Okay, so our mission is primarily the Springfield General Hospital. We wanted to be unmatched, compassionate leader in providing high quality, innovative, cost effective healthcare service to improve the lives of the people. So, just to repeat, we want to be the compassionate leader and providing high quality, innovative, and cost effective healthcare service. So, this is our overall mission. So, considering the goals, okay, next to 2 years, what do we want to achieve towards that mission? One is patients are our number one priority, right? So we wanted to improve our patients' experience. So we wanted to reduce the error rate by 50%. We wanted to reduce the death rate by 20% and improve the patient satisfaction score above 60. So that is the number one priority. The second one, expand our patient care, expand and serve 10 times more patients in 3 years. Third, healthy environment for employees. So, improve our employee engagement, improve our culture, and employee satisfaction score above 60. So, these are only the top three goals, right? So, yes, we will have further goals, but these are the top high priority goals. So, where are we now? So we served 8,560 patients last year, which is less of 2,500 from the previous year. So we kind of lost some patients compared to previous year, and last year revenue dipped 20%. And what is this? Why is this happening? And also, our prescription error rate has increased to 13%, which is 7% higher than national average. And our death rate has increased to 12%. We didn't have visibility of the medications between different departments. And our employees are not satisfied, and our attrition rate is 19%. So, why all of these are happening? What is the underlying cause? Or what do we want to, how do we want to change it? Because we wanted to be the leaders in the healthcare and we wanted to serve the people and improve the lives of the people. But the last year, our trend has been negative. So, what is the process we wanted to follow to fix this one? The first one is we wanted to understand the barriers. So we have a goal to achieve and improve the patient's experience, but also at the same time, reality is different. So, what is that barrier? So, we wanted to understand the barrier. And also, we need to engage with our team. Thank you for being the leaders. The ask is we need to engage more of our employees and get feedback from them and incorporate those. And third is what values and behaviors we want to exhibit. So these three steps, we kind of already done that exercise, and thank you for cooperating that and coordinating that with the employees. We already had a discussion about with the employees, about the staff, about the different barriers, and we also drove insights from what caused those issues. And also, some of the staff also provided what values they wanted to see, right? So, considering these, right, so we wanted to come up with a solution which can help. So, what solutions would help? So, one of the ask from you and your team is brainstorm and see what are the other solutions could help. So one of the proposal is we can automate some of our medications and history of the medications and the prescription of the medications using one of the systems, computer systems, right? Patient record systems. In case if you have any alternative suggestions, you can provide that as well. So, in the next discussion with the staff meeting, I'm also going to propose that solution and also with the various diagnostic results and insights from that. And you can discuss further with employees and staff and get the feedback further, and we can refine this, work together, and we can refine the solution. Again, every organization is unique. It's not one solution is not going to fit. So we have to find out what solution will fit good for our organization. And I want your help and support in bringing and identifying the right solution and exhibiting the right behavior. The next is, do we have right people performing the right roles and responsibilities? So we may want to, if once we identify the solution, so we may want to take a pilot department and exhibit that solution or implement that solution in that pilot department. And then we wanted to assess whether we have right people in that pilot department doing that right roles and right responsibilities. And in case if the staff needs help, so we can provide training or support or feedback. What are the various other mechanisms through that we can help the staff and support them? And finally, we may want to evaluate, can we get the right people on our bus? So, and then wrong people off the bus, right? So, once we identify, see the pattern in the pilot department, and if the pilot project is successful, we can execute this solution eventually in all other departments. Okay, so what is the next action item? So I want you to brainstorm and get the feedback from the staff about the proposed solution by end of next week. Let me know if you have any alternate solutions, and we can still brainstorm and come up with any other ideas. And if you see any cons for this approach, feel free to discuss further. And if you have any questions, please ask. And feel free to reach out to me anytime to discuss this further. Thank you.